Welcome to my life. Hello. Hello, guys. Welcome to my life. This is your favorite nurse Nancy. Welcome to Nurse Nancy's Forum, Life Teaching and Lifestyle. Please tell me where you're watching from. Can I get a hi in the comment section? This is your favorite nurse Nancy. Oh, my video is not clear. Hi. Welcome to my life. This is your favorite nurse Nancy. Welcome to Nurse Nancy's Station. What's wrong with my phone? It's not clear. Okay, it's from my camera. Hello everyone. Nobody has joined yet. Please tell me where you're watching in the comment section. We'll have a very great topic to discuss today, an interesting one. So you can afford to miss it. Can I get a hi in the comment section, please? I'm coming back to be there. You hold me like that, if it's true like that. I'm coming back to be. Hello, can I get a hi in the comment section? Welcome to my live. This is your favorite Nurse Nancy. Welcome to Nurse Nancy's Forum, Health Teaching and Lifestyle. You're welcome. What's going on? Welcome to my live. Hello. You're welcome to Nurse Nancy's Forum, Life Teaching and Lifestyle. Can I get a hi on the comment section? Tell me where you're watching from. We'll have an interesting topic to talk about today. You're welcome. You're welcome. Please tell me where you're watching from. Okay, today I want to talk about postpartum hemorrhage, as bleeding after birth. I want to tell you why I want to talk about the topic today. Is one of the major causes of maternal deaths worldwide. And what I want to talk about it is actually something that can be prevented. And why I'm interested in the topic today is I was once a victim. My second birth, I had postpartum hemorrhage. They nearly took my life, but God saved me due to careless mistakes done by people that handled the delivery. So I want to talk about postpartum hemorrhage, the causes, how it can be prevented, because it's actually something that can be prevented and is one of the leading causes of maternal mortality worldwide, especially in African race. So I want to talk about it today. Hello, hi. I can't pronounce the name. Arvagama. Please tell me where you're watching from. Welcome to my live. Welcome to Nurse Nancy's forum. Hi, Imran Ali. You're welcome. Okay, I want to talk about postpartum hemorrhage. Postpartum hemorrhage, bleeding after delivery. Okay, he's asking me what's my life all about. Okay, my life is all about teaching, health teaching, okay? You stay on my life, you listen to a lot of health topics. Like yesterday, we talked about how to control a lipid profile. We talked about how to control it naturally, especially the bad cholesterol. We talked about how to control it naturally. So today, he's asking if I can teach maths. Oh, I wish I can. I will look into it. But I'm focusing on health teaching, all about health inspirations. That is what my channel is all about. Okay, he's asking about diabetes. Yes, but it will be another topic. It will be a topic for another day. Maybe I'll talk about it tomorrow. You stay on my live exactly this time. I will talk about it tomorrow. Yes, I can talk about it tomorrow. Okay, so today I want to talk about postpartum hemorrhage. Okay, it's actually bleeding after delivery. It could be primary, it could be secondary. Primary postpartum hemorrhage is bleeding that happens immediately after birth. Immediately after birth. So it could, while that of secondary postpartum hemorrhage, that one occurs after 24 hours to after 24 hours of birth. And that one could be, okay, he's asking how to stop it. Are you asking how to stop diabetes or how to stop postpartum hemorrhage? Just listen to what I'm talking about. I'll explain it in details. Okay? This postpartum hemorrhage is one of the leading causes of maternal deaths. Okay? So it's actually excessive bleeding. I will talk about diabetes tomorrow, okay? Just stay on my live. Tomorrow because of you, I'll talk about it tomorrow. But today I'm talking about postpartum hemorrhage, bleeding after delivery. That's what I'm talking about today. So you stay on my live, you listen to me, and I promise you benefit a lot. Even if it's not useful to you, I'm not a doctor, I am a nurse. I'm a registered nurse midwife. So I want to talk about PPH, postpartum hemorrhage. Is one of the leading causes of maternal death worldwide, and it can be prevented. I was once a victim because I was poorly managed in my second birth. It nearly took my life, but God saved me. So I want to talk about it today. Are you listening? So what is this postpartum hemorrhage all about? It's excessive bleeding after childbirth. It's usually defined as a loss of greater than 500 ml of blood via vaginal birth or 1,000 ml of blood after cesarean delivery. Do you understand? So what are the causes of this postpartum hemorrhage. There are lots of causes. There are lots of causes. Number one is uterine atony. There's something we call uterine atony. It's one of the most leading causes of postpartum hemorrhage. There's the bleeding that commences immediately after childbirth, uterine atony. And what can cause this uterine atony? Uterine atony is the failure of the uterus to contract. After delivery, the uterus is supposed to contract. So when it contracts, it expels all the remaining concept of conception, expels it out. So when the uterus fails to contract, it can cause uterine atony. And then when a woman has full bladder, you have full bladder, and you enter into labor without emptying the bladder, or the doctor conducting the delivery fail to empty the bladder, it can cause uterine atony. As when this occurs, what happens is bleeding after birth. So you see, it can be prevented. It can be prevented. So this uterine atony is one of the major causes of maternal bleeding, postpartum hemorrhage, immediately, the bleeding that starts immediately after delivery. Uterine atony is one of the major causes of it. So another cause we want to talk about is retained placenta. We have 3 stages of labor. The first stage, the second stage is delivery of the baby. First stage is just from strong rhythmic uterine contraction. Second stage, delivery of the baby. Then the third stage, from delivery of the baby to delivery of the placenta and control of hemorrhage. After delivery of the placenta, it is expected that all the product of conception is out. Uteri is expected to be controlled, contracted. So the midwife or whoever that is conducting the delivery is supposed to observe the third stage of labor completely, deliver the placenta through controlled contraction. So if actually this process is not being maintained, do you understand? And there are retained placenta tissue in the uterus, it can make the uterus not to be contracted fully, and that can lead to what? Bleeding. So when there are retained products of placenta in the uterus, it can cause bleeding after birth. So another cause of it is trauma. Maybe there is a tear in the cervix, or there's a tear in the vagina or perineum, or the midwife fails to identify the tears and suture it as needed. It can lead to bleeding. So especially when there is cervical tear and the person conducting the delivery didn't know. So the woman can bleed from there, can even bleed to death. Okay. You said I should try changing your topic. Oh, I just want to talk about PPH today. Tomorrow I'll talk about diabetes. Please, I want you to join my live tomorrow, but exactly by this time, please. Okay, another causes of it could be blood clotting disorders too. Can also cause, if the woman has blood clotting disorders, okay, it could cause that. It could cause what's it called, postpartum hemorrhage. Like during one of my shifts, I had a woman who had this blood clotting disorders. She's hemophiliac, and the doctor failed to get the woman's history before she goes into labor. He didn't know that the woman is hemophiliac. He has blood clotting disorder. So after delivery, this woman started bleeding. She started bleeding uncontrollably. They gave a lot of blood, 3 pints of. They are giving the blood is going out of her system. She bleed. Okay, great. She talks about thyroid. Don't worry, all these topics I'll discuss about them. Okay, I'll talk about. I said not everyone will watch my content. Just giving you advice. Okay, about thyroid. grave disease. Imran Ali, I've heard about it. I'll talk about them, okay? I'll talk about them. I don't want to be distracted, okay? I'll talk about them. You just want me to change my topic today because of you? I will, I will, I will. Let me talk about that one, okay? I'll talk about them, I promise. Okay. Like what I was saying before, I was telling you a story about how a woman died during delivery. She had this blood clotting disorders, and the doctor that conducted the delivery didn't read the woman's history. She has a blood clotting disorder. The woman is hemophiliac, and the doctor didn't know. So after delivery, she started bleeding. They tried to control the bleeding, but it was not possible. A lot of blood was given to her, but she had about 3 or 4 pints of blood. As they are giving the blood, she's also bleeding. They didn't know what to do. It was later that they discovered that she had blood clotting disorders, and she has passed out. You see? So, what are the risk factors to tell me where you're watching, please? Hello, welcome, Temple. Okay, you're welcome. You're welcome to my live. This is Nurse Nancy's teaching, Nurse Nancy's Forum, Health Teaching and Lifestyle. You're welcome, please. Today I am talking about postpartum hemorrhage. So I said it's one of the leading causes of maternal mortality. And I talked about the causes. I've mentioned lots of things that can cause it. And now I want to talk about the risk factors. The risk factors, we have prolonged labor. If this woman has labored for a long time, labored more than 12 hours, it can predispose her to bleeding after delivery. And then if this woman is having a twin gestation, is having multiple pregnancy like twins, it can also predispose her to having PPH, postpartum hemorrhage. And then you also have over distended uterus. Maybe she has full bladder. She has full bladder. Full bladder can predispose her to bleeding after delivery. And then if the woman has history of postpartum hemorrhage, that is if she has experienced this before, she's also at higher risk of having it again, higher risk of occurrence. And then if there is induction or augmentation of labor, like for instance now, if a doctor wants to, maybe the woman is not progressing during labor, and the doctor wanted to assist her to assist the delivery by giving oxytocin. Oxytocin, sometimes they give misoprostol, okay, to augment labor. If they want to give misoprostol to help the contraction process, actually, we normally make sure we do cross-match the woman, get her blood group, and then keep blood available before they do that, because it can predispose the woman to PPH, induction of labor. So anytime any doctor wants to do induction of labor, make sure that there is available blood around. In case of any emergency, you can transfuse the woman immediately. So, and many people can go into this bleeding without knowing. What are the signs and symptoms that the woman is having this PPH? Heavy vaginal bleeding. Like during my own time, because I'm into health, I was able to discover it earlier. I was bleeding. I told those people around me. People that manage me that time, I don't think they are, skilled hands. I told them I'm bleeding, They were not able to identify that, but because I'm into the system, I was able to identify that I was bleeding. Vaginal bleeding are the signs and symptoms. falling blood pressure, see the blood pressure of the woman going low, fast pulse rate, increased pulse rate, the woman looking pale, cold climate skin, weakness or collapse. These are the signs that the woman is going into is bleeding. So let's look at how this woman can be managed. Well, if you notice that this woman is bleeding after delivery, you have to take immediate, as a healthcare professional, you have to take immediate action. Check her vitals, you call for medical team around, because not something one person can manage. It's a teamwork. All hands must be on deck to manage this woman. First of all, you have to try massaging the uterus to see if the uterus can contract. So if the uterus can contract, it can help to stop the bleeding. If that one fails, what do? You administer uterine drugs like oxytocin or misoprostol. When you administer that, you watch and see if it will stop the bleeding. But if it didn't stop the bleeding, you check if there is any tears. This is a possible immediate action you can take to stop this bleeding. You check if the woman has tears. If she has cervical tears, if she has a perineal tears, you suture it. And then you check if there is retained product of placenta. These are the things that can cause her to bleed after birth. You check if she has a retained product of conception, you remove it. If there is a laceration, you suture it, These are the immediate actions you have to take to save this woman's life, because she's actually bleeding. She can bleed to death. If you don't know what to do, she don't buy or she don't go. So you have to take immediate action to observe this woman. Okay. Then through the resuscitation, this woman is actually losing blood. So what do you do? You have to do all possible best to see that there is fluid replacement. She's losing blood, arrange for blood transfusion immediately. Blood transfusion, IV fluids should be given to her to keep her going. So now, let's look at prevention. How do you prevent this? Active management of third stage of labor is very, very important. Third stage of labor, if it's not properly managed, she can enter into postpartum hemorrhage. And from postpartum hemorrhage, the woman don't buy the go. So you have to observe your active management of third stage of labor as a healthcare professional. You, one that is not into health, you have to be observant. Observe what those people are doing. Observe. This woman is supposed to be managed actively. Observing control contraction, delivery of make sure the placenta and all the remnants is being delivered completely. There's no one remaining. And then make sure that the uterus have contracted enough, because if the uterus fails to contract, what happens? The woman will start bleeding. So the uterus has to contract after delivery, so that the woman will not bleed to death. Then you give oxytocin. Immediately after delivery of the baby, you give uterine drugs like oxytocin after delivery of the baby. And then you control contraction. Give uterine massage. This helps the uterus to contract. And then you identify and prepare for high-risk mothers. If the woman is at high risk, you have to monitor her closely. This one is actually uh, the one that is happening immediately after birth. The one that happens 24 hours of birth, and maybe the woman has been discharged, has gone home, still bleeding. Could be related to infection or related to one or two things. Okay, so these are the major causes of it. So we emphasize early detection and prompt management. It saves life. You encourage hello. Imran Ali has gone out. He said I should talk about I should talk about Graves' disease. I should talk about thyroid disease. I promise I'll discuss this. I'll discuss about it, please. I'll talk about them, please. Okay, like what I was saying now, I why I want to talk about this topic is that I was once a victim of postpartum hemorrhage. First of all, I was poorly managed in my second birth, where I registered for ANC. During my time I was in labor, it just came up. I was not prepared. Don't mind me being a healthcare professional. So we went to a nearby hospital. I didn't really know about their delivery outcomes and all that. We went there. The doctor that was there is doing is an archaic doctor that is into private practice. Those doctors that don't update themselves. That's where I went. Okay, so I went there. People, nurses there, they are not registered nurses. Imagine me, a registered nurse being managed by people that are not registered. I was just helpless. Even when I was telling them what to do, they got angry with me. I labored for so long. I went into labor with full bladder. Even the doctor failed to tell me what happened to me. It was after delivery of my baby. I started bleeding heavily. I noticed I was bleeding even with pain and all that. And then they didn't even give me oxytocin. The drug they gave me was egometrine. I asked them the drug was, I saw it was egometrine. I told them, it's not everybody you give this drug. I didn't ask if I have history of hypertension and you're giving me egometrine. They got angry with me. They gave me ergot. I don't have a choice now. It was already in their hands, so I have to be a patient. So I was there after labors for so long with full bladder and all that. When they left me there in the delivery room, I was screaming. And they now came to their senses and all that. Baby came out, thank God. And after some time, I started bleeding heavily and all that. So I noticed I was bleeding. I called them. They said nothing is normal. I said this one is not normal. Oh, I'm bleeding. You know, they failed to identify that I was bleeding. The bleeding was coming intensely. I told those I call them nurses. They are not. To go and call the doctor. He came. He checked. Went back. The bleeding was there. To a point, I started screaming, shouting for help. The bleeding was now coming very often and often. So he had to bleed my husband, collected blood. He gave me the blood was going out. A lot of things happened. I nearly passed out, but God saved me. God saved me during that time. So this was something that would have been prevented. I entered into labor with full bladder. So my uterus failed to contract. It failed to contract, and the third stage of labor was poorly managed. That was what caused that postpartum hemorrhage I had, which they failed to tell me. It was later to my brother, there was a medical doctor that called and told him, please empty the bladder. He said, when he tried to empty the bladder, I was not cooperative. He has to leave me, this and that. So when he now emptied the bladder, even my brother told him, even if you do anything you do and you didn't empty the bladder, she will continue to bleed because after he emptied the bladder and everything, I think the bleeding stopped. The bleeding stopped. I didn't bleed again. They were not cooperative. I don't want to talk about the experience, but I want to say that God saved me. Whatever it is, whatever the thing that caused it, I don't know. But God's mercy was there. It was God that saved me. So why I want to talk about this topic is that it's actually something that can be prevented. So dear mothers, Antenatal care is very, very important. There are some women that don't like going for antenatal visits. Sometimes they skip their visit, they don't go. No, it's very, very important. You have a visit with your doctor, make sure you go there as a pregnant mother. A lot of things. Your pregnancy can be healthy at the beginning. It might turn out to be another thing at the end. That is why we encourage mothers to make sure that they go for antenatal, the antenatal visit. And again, to start it early, at least you start it at 12 weeks gestation. 12 weeks is the, yes, if you once you notice you're pregnant and your pregnancy is confirmed, it's confirmed that you're pregnant. Yeah, ultrasound confirms it. So what stops you from going for your antenatal? Get registered, do all the necessary tests they ask you to do. It's for your health, it's for the health of the baby. It's very, very important. There are women that don't like going for antenatal visit. They don't like going for antenatal. It's very bad. So during this antenatal, the doctor will be able to identify if you are at high risk, if you're a high risk woman, identify if your pregnancy is progressing, identify a lot if there is any deviation from normal, they will identify it and know how to manage you. And also, I advise women out there, especially pregnant women or expectant mothers, if you're pregnant, try to, if go to a hospital that you know that there are qualified health personnel. The nurses are qualified, they are registered nurses and midwives. Doctors, they are qualified doctors. The hospital have a good reputation. You go there and register. If you have money, you can register two places that are very good. So that if these other people tell you this other, you check, you compare what's the result of the two hospitals. Okay, that's my advice. This pregnancy of a thing can come up with a lot of things. So we have to be very careful where we go for our visits. There are people that they will be pregnant, they will just be going for the antenatal visits in one local area, or even they will go to prayer houses that they are doing antenatal there, which is very bad. You know, so I encourage you, mothers, pregnant mothers out there, to be serious with your antenatal visit. It's very important. Don't skip anyone. If you're given any drugs by your doctor, try and take them. If you're recommended to do any tests, don't avoid anyone. Try and do all of them. It's for your own good. It's for the health of your baby and for your own good. So you are not doing anybody by skipping any of them. You're doing yourself. So you want to have a healthy pregnancy, a healthy delivery, a healthy baby. Antenatal care, antenatal visit is very important. It's from there that they'll be able to identify if there is any deviation from normal. It's from there they will be able to identify if your child is growing or not growing. It's from there they will identify if there are health challenges that may affect your pregnancy. It's from there they will identify if you're a high risk woman and they will know how to manage you. It's from there they will identify if you have high blood pressure. If a woman has high blood pressure during pregnancy, is a very very is a high risk. You are classified as a high risk woman because you have to be on severe you have to be on constant monitoring all the time, because if you are not monitored and observed, you can go into eclampsia and pre-eclampsia and eclampsia, and that is also another leading causes of maternal mortality a lot, or even diabetes. From there, gestational diabetes can happen to any pregnant woman. So if from antenatal visit, they'll be able to identify all these things. So if you're not going antenatal, if anything happens, they will not be able to find us. Antenatal visit, from there they can also identify if your unborn baby is in the right position, if it's in transverse position, even if it's in cephalic position or bridge or whatever. We're able to identify if they will book you for CS or if you have a normal vaginal delivery. So I encourage you, mothers out there, if you're pregnant or if you are expecting, and it's time for your antenatal, go for your antenatal. It's very important. All right, thank you for joining my live. I'll be going off to right now. Thank you, thank you. Tomorrow, like Imran said, I'll talk about diabetes. I also talk about thyroid disease and Graves' disease, just like you said, we should talk about it. Okay. Thank you very much. I have other things to attend to right now. Thank you for joining my live. It's still your favorite nurse Nancy. Thank you. Thank you. I love you all.